Thank you, Wendy. We've heard so far in this session the surgical approaches, and I was looking for something kind of catchy, so I came up with this sparing the knife. And I just want to go on record, there's nothing wrong with knives. We use them all the time. But sometimes you don't need a knife, you need a spoon. And so, as we've heard so far today, a lot has to do with patient selection, and I think in the lower lid area particularly, that it's a challenging area, and as Wendy said before, not everybody is the same. So Oscars the nominations just came out, and I just got some screenshots of some very familiar faces, and every one of these people has wrinkles and lines that they didn't have when they were 20. Now, some of them look better than others, and you'll note that Renee Zellweger here, this is her before plastic surgery picture when she still looked like Renee Zellweger. But I got all of their permission to use these slides, so don't worry about it. Not all facial lines are created equal. I guess that's my take-home message. And so as we evaluate people who come in looking for some sort of rejuvenation, it's important to know which tool to bring out for the different problems. So if I could categorize wrinkles and lines into 3 different areas by anatomy and pathophysiology, I'd say the first area would be gravitational pull and loss of volume, the descent and deflation. And for these types of patients and these types of lines, the things that we like to use are things that lift and things that inflate. So facelifting techniques, mid-facelifting techniques, brow lifting, fillers. Then there's another type of wrinkle that's created simply by muscle action. And around the eye, the most common areas are the glabellar folds, which are created by the action of the corrugators and procerus muscles, and the crow's feet lines from contraction of the orbicularis, and then the horizontal rhytids in the forehead created by frontalis contraction. And so our tools here are to immobilize those muscles by temporary paralysis using any of a variety of injectable products. And the final one, I would say, is skin damage. Now, this is not a before and after. These are twins. Guess which one loved to smoke and lay out in the sun? Twin on the left. So I would say arguably, and that's what I'm going to focus my comments on, is skin damage. And I think it could be argued that skin texture and quality might have the greatest impact on how we age, particularly around the eyes. And smokers and people who have worshiped the sun, people with Fitzpatrick 1 pale skin, they just tend not to age quite as well. So what's the solution? A sunburn. Well, not technically. We're not going to send our patients out poolside. But one wonderful treatment for skin texture issues is to exfoliate the top layers. Now, a sunburn is the most commonly known way of getting exfoliation, but it's not recommended because the UV exposure obviously exposes the patient to cancer risk. However, we can take off the top layers in a variety of fashions that doesn't expose the patient to any cancer risk, but also helps to rejuvenate the skin. And there are different modalities. You can get a laser, you can get sandpaper, which is essentially what we're doing with dermabrasion, to take off the top layers of the skin. And you can also use chemical exfoliation, which I think has some advantages. And I'm going to share my experience over the last year or so with this particular modality. Exfoliation is nothing new. There are cultures that have recognized that salt, heat, mustard, sulfur, all of these types of things can take off the top layers, and they figured it out that people looked younger and more refreshed after the application of these products. So what happens when we age? No matter which derm component that you're talking about, there is thinning, there's degeneration, disorganization, and destruction of the skin when you go from normal, healthy, young skin to photo-aged, damaged skin. So the way exfoliation works, chemical exfoliation in particular, is that with the penetration of the chemical agent, it causes temporary cell necrosis and inflammation. And because of this insult, the body responds by repairing itself. We see an increase in dermal thickness, in collagen fibers, and elastin fibers, hence the rejuvenation appearance. And I want to thank Ron Mancini for these histopath slides that he provided for me. So if you are thinking about peeling, and let me just tell you that I was not set out to be a part-time dermatologist. I just want you to know that, Jolie. I was sending my patients who I thought would benefit from lower lid texture rejuvenation to my favorite local dermatologists and their estheticians. And they would send them right back to me because as familiar and confident as they felt across the body, around the face, it was like there was this invisible fence about the area that's covered by glasses. They would not venture inside that zone, whether it was a lid ditzel or a chalazion or a papilloma, and certainly not chemical exfoliation, at least not in my community. So they would send them right back to me. So I said, well, what's more likely? Am I going to make my dermatology colleagues more comfortable around the eyes, or can I learn this chemical technique? And I figured the latter would be a little bit more easy for me. So I just took an afternoon off and I went to my dermatologist's office and I watched her esthetician apply chemical peels. And I also spoke with a couple of eye plastics ophthalmologists who have done this for their help as well. So I educated myself. And so the way we treat these patients pre-peel is we ask them to keep on with their normal cleansing and moisturizing regimen, and if they don't have one, to adopt one. But do not put anything on the skin the day of the peel. They should also limit sun exposure because you don't want to be applying peel to an area that has been stimulated and the melanocytes activated. If they have a history of cold sores, you should consider pre-treating them with antivirals like acyclovir. And if they have used isotretinoin or something like Accutane because they've had acne, you should avoid chemical peeling products because this can increase the risk of sun damage. I would caution first-time peelers, and as you're learning this, to keep your peels to people with lighter skin tones. People in Fitzpatrick's 3, 4, and 5, you should approach with caution. There can be a role of using pre-bleaching agents in darker skin tones. So the chemical selection. Again, I am not trying to become a dermatologist. I did not want to deal with the potential complications of deep peels, so I would recommend that you stay with the superficial and maybe superficial medium depth peels. I personally like to use 20 to 30% TCA, which is readily available. In my office, all you need for this, you don't need a laser, you don't need to purchase a dermabrasion machine, you don't have to keep up with software. All you need is what most of us have or can readily obtain in our offices. You need acetone, which is the same thing as nail polish remover. You need your product, your TCA product, which you can order from medical grade. You can also order, which I'll show you in a moment, online. A few 2x2 or 4x4 gauze bandages, some cotton tip applicators, and a fan. Once you have all this, you're ready to start. So this is a patient, and I've not edited this so you get an appreciation in real time for how long this takes. Because of the fumes from the acetone, which I'm applying now, I usually put a drop of opthane or some sort of tetracaine on each eye. Now, natural skin oils will neutralize and tend to negate some of the beneficial effects of the penetration of the product. So you want to make sure you degrease the skin with acetone. So here I am, I've got cotton tip applicators, I've got a shot glass that I brought back from a trip someplace, and I've got a small amount of chemical peel in that shot glass, and I dip the cotton tip applicator in and I simply wipe it on the surface. Now this patient has not received any topical anesthetic, she's not taken any Valium. What she's starting to feel though is just a slight burning sensation that's going to come to a crescendo. Now, TCA does not require any neutralization. It self-neutralizes on its own. So I talk them through this period of time as this burning sensation is increasing. I assure them and reassure them this is going to come to a climax, and then there's going to be a denouement, and it'll all be over. And so with subsequent passes, you're going to get a deeper peel. And this frosting is not necessarily your endpoint, but it is a sort of a consequence of the beginning reaction of this chemical product. Now, she only needed her lower lids done. I've had some patients who've been so happy with this that they've asked me to do their full face. I try to send them to my dermatology colleagues for that, but obviously you can treat any area. And I try to feather the areas as I get to my end zone. I try to feather a little bit with a few passes at the outside there so there's not such a demarcation line. You can see my assistant is fanning her at this point as it's reaching its crescendo. And that's it, real time, no edits. Afterwards, I ask the patients to keep that area dry. and to apply moisturizer after about 24 hours. They can use cool compresses as needed for the discomfort that they feel or any itching and puffiness. And normally on about day 2 or 3, they'll start to have a little bit of exfoliation, and they can take a cotton tip applicator and aid that process if they like. They should avoid the sun for a couple weeks and use sunscreen thereafter, and avoid direct sunlight for several weeks. This is the patient in the video pre-peel. This is her at 1 week with quite a significant amount of redness in the nasolabial, in the tear trough area. This is her 1 month out, and this is her 2 months out. So her before and her afters. And if you look at her before picture on the left, as Wendy was saying, this is not a great candidate. She doesn't have any fat herniation. She's got very little in the way of excess skin, but she wasn't happy and just wanted a little bit of rejuvenation, and I thought this was an ideal candidate for this type of intervention. This is a patient who took some selfies of herself. She was very concerned about the amount of swelling that she had at 3 days. I talked her through it. 10 days later, she was off the cliff, off the edge, and very, very happy with her results. I did a screenshot of an online shopping mall that is also the same name as a large river in South America, just to show you that this is something that our patients can buy online. And I highlighted in red here the medical disclaimers that you find on this website. So patients can buy this online. However, that should not minimize the trouble that they can get into, because complications can be severe. Pigment changes, prolonged redness, these are some very unhappy patients if they're not prepared. And again, why I try to stick to the more superficial fields, because I do not want to deal with these things. But if I were to get them, I would rely on my dermatology colleagues and maybe send them down to Jolie in Miami for her to help me with those. So peels, are they for you? I think it's an economical approach. It's using things most of the time you already have in your office. Informed consent and patient selection are paramount. I'd like to go on just for a couple of products, neither of which I have any financial interest in and neither of which I really use, but there are a couple of new things out there I want you to know about. There's something that's basically like Spanx or undergarments for your eyes. This is the true name, Instantly Ageless OMG Facelift in a Bottle. And I was at my local health club and they were peddling this, and this shows patients with one side treated and one side not. Very dramatic results. And the way this works, it's similar to another product that you may have heard about called Neotinsel. And these are products that are applied and cause a little shrink wrapping, so there's a base layer and then a second layer that's applied by you, the doctor, or the patient themselves, like a makeup application, and there's a cross-linking process that then shrink wraps and basically holds the lid bag in place. So you've got a patient here, baseline on the left, and 2 minutes application on the right, 1 hour after application, 2 hours after application, and then 5 minutes after removal. So as soon as it comes off, just like you would take off your Spanx, that little bulge is back. So here are some patients here, unretouched apparently from the company, and I want to thank Brian Beisman for these slides, but the before and afters, and these are young patients. They don't need skin removal. They really don't have a lot of fat herniation. Most of the time, these are genetically related sort of periocular changes. But you can see some benefits here. I think people who come in with dark circles under the eyes, if they're from topography and they're shadowing, I think that this type of product can improve things. If the dark circles are more pigment and genetic, I don't think this is going to improve things. I had 3 patients who signed up for a little trial of this. I had my Neotinsel rep come in and apply it, and all of them thought that it helped a little bit. One was going to a bat mitzvah that night, and she was all excited to look real good for her bat mitzvah, and she went to the bathroom during the bat mitzvah, and she looked in the mirror and realized it was starting to peel off like Elmer's glue, and you're little and you got a little layer of Elmer's glue. So she just took it off. She said, you know what? It helped. I thought it looked better, but it's a relatively expensive product at about $10 per application. So I think there's probably going to be some limitation because of the pricing in this. But again, something else that your patients might come to you about, or something else just to know in your armamentarium. So is it true that you can take a pig's ear and turn it into a silk purse? Well, we've told we can't, but maybe sometimes we can, depending on which modality that we choose. So the take-home message here is that the lower lids in particular are a very challenging area. There's a role for knives, there's a role for fillers, there's also a role for skin texture rejuvenation, and you've got lots of options, and some that I think are very accessible to the general ophthalmologist. Thank you very much.